interests include anchoring, singing, poetry writing. It's a privilege to have you here amongst us, sir. We have people joining from MUHS campus, and then the same is relayed on YouTube Live. So we have some other audience who are joining us on YouTube Live. Over to you, sir. Thank you, sir.
Thank you very much. All of you are listening my voice.
Yes, sir. Yes, sir. Please go ahead, sir.
Okay. So I am very thankful to Maharashtra University of Health Science Nasik. It gives me opportunity to talk in a guest lecture on communication, importance of communication skills in the medical profession. I am Professor Dashrath Chaudhary, former assistant professor in English Konkan Gyanpith College of Engineering, Karjat, Raigad. Before starting the guest lecture, I express my sincere thanks to the Honorable Lieutenant General Madhuri Kanitkar, retired PVSM, AVSM, Vice Chancellor of University. Second number, Honorable Professor Dr. Milind Nikum, MD, Sharir Rachna, Pro Vice Chancellor, and Honorable Registrar Dr. Rajendra Bangal, Honorable Dean Academics Dr. Mrunal S. Patil, and Honorable Dr. Jayant Palaskar, Professor and HOD of Department of Dentistry. Honorable Dr. Pradeep Avle, Associate Professor in Ayurveda, and Honorable Dr. Ashutosh Oja, physician, and all other professor and dear students who are listed on this occasion of joining the importance of communication skills. Now, I want to say all of you that the communication skills in the medical profession is very necessary. Without communication in any type of profession, if we don't know the communication skills, we cannot go ahead. So, listening listening is most important in medical communication. It allows your patient to share their thoughts and feelings, will provide you valuable information. So doctor and patient communication must be clear for medical issue. Doctor, nurses, medical staff, administrators, and office employees, everybody communicate with the patient and co-workers. So this is the importance of the communication in medical professional life. Uh, Yes. Communication word is taken from the Latin word, which means commonness. Communication is the process of transmitting information, thoughts, opinions, message, facts, ideas, emotions, and understanding from one person, place, or thing to another person, place, or thing. So that is why the communication is important for our professional life and medical learning also. Now, role of languages in communication. So, our profession may be teaching or any medical profession or any type of profession, but we all need to have the knowledge of at least 3 or 4 languages. As per the study, I have known that if the person know 2 or 3 languages, so his mind works multiple way. So sometimes patient comes, they some any patient does not know Hindi or Marathi, so we can communicate in the local language also. So that is why the role of languages in medical communication or in general communication is very necessary. So I think that the uh, languages play the greater role in communication, though here may be the matter of the medical profession. Here you can see the people are sitting on the table and they are discussing from each other. It may be also the matter of medical discussion. Now, the significance of the word skills. Suppose we are working in any type of professions, we need the skills. So now that is why our honorable Prime Minister is focusing on this word skills. So skill means you should be expert, smart, perfect, complete, and having the mastery in your work. Suppose we are working in the medical profession, so what may be our role in medical sector? But whatever the responsibility we are handling in the medical profession, our skill must be expert and good. It can help in handling the patients and all other workers. Communication is the only Communication is the only medium of connecting with the people and the world. All the listeners, I will like to share that if we do not communicate with the people, we cannot get the business, though it may be connecting with the patients, maybe pharma people, and maybe doctors, and any type of connectivity may be there. But we must have the good communication in the field of the medical sector. So our good communication connect us to the people of the world, though we are working in medical sector. Here I am. Here we find the mass media communication and technology. Here is the picture of the legendary singer Kishore Kumar. But I will say on the contrary that now this is the time of technology. By using the technology we can communicate, and here I will put the example of the medical telemedicine. Telemedicine is one kind of a terminology that by listening the voice of the other from the other side, we can decide which type of medicine can be provided to the patients. And there is another one type of terminology that is we call the medical transcription. From the other end, the patient just say his problem in his or her voice, and our side that is being text. And by creating the text we can decide which type of medicine that patient requires. So now this is the most approachable technology that we can treat the patient who are far away from us. Yes, here is the picture of language laboratory. But I will say that on sitting the this type of laboratory, we can hear the problem of the patients, those who are sitting in the different corner of the India and the world. They can, if they are not able to come to your hospital or to your clinic, from their side they can say their problem on screen to you, and from your side, by after listening you can suggest them what kind of treatment they require. So that is why this technology is important in the today's era, that we can provide them the better treatment who are unable to approach to us physically. Yes, in the communication, body language is very important. The best way of understanding the human mind, posture, gesture, non-verbal communication. So when we meet to anybody in any type of profession, so our body language must be positive, assertive, and approachable. So by here I will say, in case of the doctors and patients and relatives, if when they come to you, if their faces are smiling, so we can say that we are giving the better treatment to the patient, and the patient is giving us the better result in the form of developing the health. So body language says many things. Maybe patient doctor meeting or relation or seeing to each other. Yes. Now here I am showing the picture of the stadium. Here it shows disadvantages of miscommunication or communication gap. So we find that here I will put the example of the one cricket match in which, because of the misunderstanding of the communication gap, the one player got the run out from the Indian, like uh, uh, Surya. Okay, so communication gap must not happen when we are working in any type of profession. So communication should be go on in the smooth way. So it makes us the both side comfortable. Suppose we are the medical practitioner, and suppose the patients are coming to us, so the communication must be very clear. If the communication is good, so patient can say his problem, and doctor can understand what type of treatment he or she must be given. So that is why I will say that communication should be very clear between the patient and doctors and pharma industry and any type of any type of profession. So this communication gap should not be happen. Yes. Power of written communication or verbal communication. Yes. We say that when the doctor, we go to visit the doctor or hospitals, we carry with us the files of the treatment with us. That time, the doctor, nurses, and the other stop, check our case paper, which is in the written form. So by reading the history written on the paper, and the treatment given, dates, etc., advices, and the period of the treatment, etc., many things can be assessed only on the basis of the written communication. So written communication is the important part in a medical profession. Because nobody can remember the oral communication too much, maybe like a medical profession. So really the written communication is very important, and I have seen whenever we go to the doctor to visit, so he note down our name, date, treatment, and given the medicine in written format. So it is necessary to have the written communication power in us. Now, Conclusion. Before conclusion, I will say that overall story of this session is that communication may be as a general term, but without communication, we cannot work in any type of profession. And I will say the medical communication helps the patient develop a comprehension, understanding of current care involving health situation. And also, pharmacists need communication skills because they go to the various doctors to show the medical product to the physicians. And overall, I will say that the importance of the communication skills in the medical profession is very necessary. Without without communication skills, we cannot work. So I, in the short time of this period, I have tried to show you that what is the importance of the communication skills. And ultimately, the human being is the base of communication. And communication may be in term of the treatment, in the term of the medical communication. So this is the very necessary. And yes, sometimes we need also PowerPoint presentation to show the case in the mass level. Suppose when we go to show the presentation in the medical seminar, so that time PowerPoint presentation is very necessary. We can show any type of health case paper in the visual manner to the public or to the audience. And yes, interpersonal communication skills are important also for the pharmacist to master, whether counseling patient, communicating with the physicians, interfacing associate. Pharmacists use their interpersonal communication skills daily. Effective communication by the pharmacist or the doctor is essential to improve the use of medication by the patient. There is ample opportunity for the students to enhance their communication skill in the community pharmacy or the medical practitioners. Communication skills with the colleague. Most individuals will be working with other pharmacists or doctors, support staffs once they graduate. Therefore, learning and using interpersonal communication skills within the workplace is an important activity for the student. Good communication in the workplace begins with the respect for their co-workers and a willingness to be a team player. To help ensure that co-workers are communicating with one another, regular staff meeting should be scheduled to bring up problem or issue in the workplace in a non-confrontational or non-blaming way. A staff meeting is not the time to direct a personal attack, and all staff members should be reminded that staff meeting should encourage participation from all the co-workers, from the pharmacists or maybe doctors, nurses, and other staffs and technicians. Now I will say about the conflict management. Conflict management also important in the medical sector. Sometimes conflict happens, so we can control our conflict management through the proper communication. So another thing is that documentation is becoming more and more important in all practice setting. Yes, they can determine the area they need to document more effectively. Yes. So overall, I will say the communication is most important area in any type of profession. So suppose you are working as the doctor, as the nurse, as the student, as the pharmacist, and ultimately our last goal is to is the patient. If we if we are we are if we become successful to recover the health of the patient, we feel that we have done our job best. So now I think the medical profession is considered the best profession in the world. So thank you very much for listening my lecture over here. Now we shall now I say thanks. This is my information is appearing on the screen, and anything uh, now I will ask as a you know from your side, sir.
Yes, sir. Thank you very much for very informative lecture on the communication skills. It is really very useful for students and other faculty. So I really thank you for sparing time and delivering the lecture on this. Thank you very much, sir. I would like to also recognize the presence of Honorable Pro Vice Chancellor Dr. Nikum
Uh,
sir for the lecture and other faculty members. Thank you very much, sir. Thank you. We end the meeting here only.
okay, okay.